Hello everyone, welcome back. In this video, we will learn about bacterial vaginosis in women. The information provided in this video is taken from the National Health Service, ensuring accuracy and trust. Bacterial vaginosis, BV, is a common vaginal condition that affects many women worldwide. While it is not a sexually transmitted infection, STI, it can be triggered by sexual activity and periods. What is bacterial vaginosis? Bacterial vaginosis is a condition where the natural balance of bacteria in the vagina is disturbed. In a healthy vagina, there are good bacteria, lactobacilli, that help maintain acidity and prevent infections. However, when there is an overgrowth of harmful bacteria, it can lead to bacterial vaginosis. Diagnosis of bacterial vaginosis. Bacterial vaginosis is diagnosed by meeting at least 3 out of 4 Amsel criteria. Number 1. Thin discharge. A thin, white, gray, or milk-like discharge that coats the vaginal walls. Number 2. Clue cells. Vaginal epithelial cells that are heavily coated with bacteria seen under a microscope. Number 3. Vaginal pH. A vaginal pH greater than 4.5. Alkaline environment. Number 4. Whiff test. A smelly discharge when 10% potassium hydroxide, KOH, is added to vaginal secretions. If 3 or more of these criteria are present, a diagnosis of bacterial vaginosis is confirmed. Symptoms of bacterial vaginosis: thin, watery, grayish-white discharge, smelly discharge. It is usually not associated with itching. Some women may have no symptoms at all. Bacterial vaginosis is not a sexually transmitted infection, but it can increase the risk of developing STIs, including chlamydia, gonorrhea, and HIV, by reducing vaginal acidity and natural defenses. What are the risks of bacterial vaginosis? The exact cause of BV is unknown, but several factors increase the risk. Sexual activity, having a new or multiple sexual partners. Antibiotic use can disrupt the balance of vaginal bacteria. Douching or using vaginal washes. These disturb the natural pH hormonal changes. Menstrual cycle, pregnancy, or menopause. Poor vaginal hygiene practices. Bacterial vaginosis in pregnancy. Bacterial vaginosis slightly increases the risk of pregnancy complications, such as preterm birth or miscarriage. However, it does not cause problems in most pregnancies. If diagnosed during pregnancy, bacterial vaginosis should be treated to reduce risks. General measures to prevent bacterial vaginosis. To reduce the risk of developing bacterial vaginosis and prevent recurrence, follow these measures. Maintain good vaginal hygiene by washing with plain water only. Avoid vaginal deodorants, scented wipes, or douching. Take showers instead of baths to prevent irritation. Avoid antiseptic liquids in the bath. Use a mild detergent to wash underwear. Quit smoking, as smoking is linked to an increased risk of bacterial vaginosis. Practice safe sex, using condoms to reduce bacterial imbalances. Treatment options for bacterial vaginosis. Bacterial vaginosis is usually treated with antibiotics, which can be taken in tablet or gel form. Number 1. Metronidazole. Tablets, 7 days. Avoid alcohol during treatment and for at least 2 to 3 days after completion. Mixing metronidazole with alcohol can cause nausea, vomiting, headache, and facial flushing. Number 2. Clindamycin vaginal cream, 7 days. This cream weakens latex condoms, increasing the risk of unintended pregnancy. It is recommended to avoid sex during treatment or use a silicone condom or alternative contraception. Follow-up. After 7 to 10 days, a repeat test may be done to ensure the infection has cleared. Referral for further investigation. If bacterial vaginosis keeps coming back frequently, a referral to a GP or sexual health clinic, GUM clinic, may be necessary. If a patient has repeated infections 4 or more times a year, a long-term antibiotic gel might be recommended for a few months. If bacterial vaginosis is suspected to be triggered by sex or menstrual cycles, the doctor will help identify potential causes. Frequently asked questions about bacterial vaginosis. Question 1. Why does bacterial vaginosis keep coming back? Bacterial vaginosis commonly recurs within a few months. If you get it more than 4 times in a year, you may be prescribed an antibiotic gel for long-term use. A sexual health clinic or GP can assess whether sex, periods, or other factors are triggering the recurrence. Question 2. Can I use yogurt for bacterial vaginosis? Yes, yogurt has good nutritive value and helps increase the body's strength to fight infections. However, yogurt alone will not cure bacterial vaginosis. Taking it along with medication can help improve the condition faster. Question 3. Does my partner need treatment? Bacterial vaginosis is not a sexually transmitted infection, so treatment for male partners is not required. However, if you have a same-sex female partner, they may also need treatment. Conclusion. Bacterial vaginosis is a common but manageable condition. Thanks for watching. And if you find this video helpful, don't forget to share this video.